Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, persistent feeling of hopelessness.
Hello, you're welcome to this week's episode of Health Watch on Advent Cable Network Nigeria. I am Angela Mweze. There are different types of birth options available to women, and a woman is at liberty to make her choice. However, sometimes she may not be at liberty to make a choice of delivery based on the uniqueness of her condition. On the program today, we shall be discussing Caesarean section. And my guest is Reverend Canon Nathaniel Adewole. He's a consultant obstetrician and gynecologist at the University of Abuja Teaching Hospital. You're welcome to this program.
Thank you so much.
I was just about to say a popular face on this because I've had you for the last couple of episodes. And
thank you so much.
Well, it's because you've really impacted. You really communicate effectively. I'm really appreciative. Thank you, sir. Yeah. Thank you. So today we're going to be discussing Caesarean section, and really what we want to achieve today is to dispel a lot of misconception about it, because people really misconstrue the whole concept, and it has led a lot of people to trouble. But first of all, I know that is one method of delivery, but there are other methods of, child delivery, because in this season we are discussing women. So I apologize to the men. They just have to deal with the women now, because we're very important on this matter. So I want us to discuss the types of delivery that are available, the options that are available to women.
Well, we have, when it comes to delivery, we have what we call spontaneous vaginal delivery, SVD. That's what they call normal delivery. Okay. And that's a popular one that everybody is used to. Mm-hmm. We have instrumental delivery, which is also through the vagina. Also, we add the last one is Caesarean section. Okay. And Caesarean section is the one in which an incision is made through the abdomen of the woman, through the uterus, in order to bring the babies out. Okay. So it's easy. Baby or babies. Babies. Okay. Yes. Because it's not a mother, that must be one. Okay.
So the what we call the normal vaginal delivery, or the Hebrew women method of delivery, as people call it, the vaginal delivery, that is when you go to the hospital, you have a contraction, and then you deliver.
There is a great misconception when they talk about I deliver like Hebrew women. And it's even made some people to even abandon delivery in hospital. And I asked them a question. If about more than 3,000 years ago, 4,000 years ago, at that ancient time, they knew the importance of midwives. Yeah. Of midwives being at delivery. I'm not wondering what is happening that nowadays we don't even want the midwives to be in their delivery. We rather want to deliver on their own, number one. Then number two, if they read that thing in context, even when the woman delivers, the midwife still gets there to salvage if there's any other thing they need to check on. Yeah. But now they would say and that's why nowadays, if you remember the last, I think we have discussed maternal mortality twice. That issue of misconception about I want to deliver like a Hebrew woman, therefore even when I'm giving medical advice, I would rather go try at home, has led to the death of an unnecessary death of women.
So vaginal birth is not necessarily the perfect type of birth.
No.
So it doesn't mean if a woman delivers through the normal, what you call normal delivery, does not mean she's superior to.
The question is this: is it written in anybody's forehead?
Of course.
Is it written? Will you be able to identify a baby that is delivered by cesarean section, or a baby that is delivered by normal, so-called normal delivery? Yeah. To me, every delivery is normal. It's normal. One is through the vagina, one is through the abdomen. That's all. All of them have the parts of the body. And in fact, ironically, insisting on delivering normal has led to abnormal babies. That's the irony. For example, a woman had insisted on delivering so-called normally. You are forcing a baby, example, if it's not too big a baby, but has a little bit of difficulty in coming out. And you have, eventually, if you force the head too much with contraction, it will come out. That baby could have low Apgar score.
And what's that?
Baby is delivered, but the brain has been compromised. Intellect compromised. It's a common, because of undue prolonged labor, it has led to what we call asphyxiated baby, demented baby. So, is it actually normal?
It's actually maybe not normal.
Exactly. So this concept that I want to deliver normally, the most important thing women or couple must get is this. The goal of pregnancy is a healthy baby to a healthy mother. Mode of delivery is irrelevant. It's inconsequential. The most healthy baby to able is not enough to deliver. It will not deliver and have liability. As we have discovered. If you deliver, you insist on delivering normally and baby is asphyxiated, baby is not dead.
But
the baby is a burden throughout your lifetime.
So we talked about instrumental delivery.
It's a form of, it's true also vaginal delivery. When there is problem, for example, if a woman is in labor, is dilated, and there's what we call fetal distress. By the time we are discussing indication for cesarean section, we mentioned this. If the inappropriate, well-selected baby, one can use instrument like vacuum to quickly bring out that baby instead of going through abdominal. There's what we call forceps to gently bring out the baby, to assist the baby to come out, provided the pelvis is adequate, the condition of the baby, the cervix is fully dilated, there's something like bladder, adequate steps are taken, well selected. That can also assist. That means you are assisting in delivery.
That's just as it's still vaginal, but it's just assisted. It's assisted.
And then there's also what you call assisted breech delivery. It's still like it, just like normal.
All right. So the topic today is to discuss cesarean section. I mean, to dispel the whole, issues around it. But cesarean section, because we've now seen that vaginal birth doesn't necessarily mean that's the perfect way of delivery. Now, at what time do you have to go for a cesarean session for a lady, for a woman who is at the point?
Maybe we should start with what are the indications or what are the reasons that we go for it?
Why do you go
for it? Because that one will also influence the timing. You know, when it comes to indications or what are the reasons that a woman may need or a baby may need cesarean section, it could be due to factors from the mother, factors from the baby, or a combination of the two. In no particular order. Let me just, one of the commonest causes is what we call cephalopelvic disproportion or fetopelvic disproportion. You see, that's a big term.
That's a big term.
Cephalopelvic disproportion or fetopelvic disproportion. That means the commonest one is CPD, cephalopelvic disproportion. That means when there is disproportion between the pelvis of the mother and the head of the baby, or the presenting part of the baby, most likely the head. For example, if the head is too big, the pelvis is normal, the atlas of the pelvis of the woman is normal, but the head of the baby is too big, or the baby itself is too big. That is a cephalopelvic disproportion. Or sometimes when the pelvis of a woman is contracted, is small, then the baby is normal. It may not be able to pass through. There are shapes, also there are types of pelvic bones you know, everything there is a variant. There are types of pelvic bones. They appear normal, but by the time you check them, there are points I will look for example, what we call sky spine. In some women, is more prominent than the other one.
Okay.
So that one will reduce the size of the pelvis border. So those are things that can lead to cephalopelvic disproportion.
Okay.
Or then another causes include something like if the placenta previa.
Okay, placenta is presented before
the baby.
Before the baby, okay.
If it is very marginal, yes, it could be managed, especially if the woman has not had episode of bleeding.
Okay.
But placenta previa is an indication for cesarean section.
Okay.
In cases where there is fetal distress,
okay,
whereby if the breathing, a woman may either during labor or a woman may come for antenatal. I want to talk of emergency or elective later, but a woman may come for antenatal. You just listen and you discover that the fetal heart rate is so high. Okay. Or during labor, you can discover that the baby is progressing. The fetal rate started going high, 180, 184.
Wow.
And you listen, you try to take steps, it's not coming down. That's a warning that that baby is in trouble.
Yeah.
Or the fetal heart rate drops so low below, some will even drop below, if once it's below 110 to 110 or 120 or minimum of 110, we know that that baby is a what? Is in trouble. Especially if you try to resource to give the mother oxygen and it still persists. Let me say this clearly. Nobody can assure that the woman will deliver normally until that woman has delivered.
All right. So you could start up normal and end up in...
The baby is normal.
Yeah.
It's normal size. The pelvis is adequate. It's contracting well. But there could be one of those things that could occur is what I just mentioned. The baby's heart rate started misbehaving then. Other thing that could call is what we call abruptio placenta.
Okay.
Whereby a woman is either during pregnancy or in labor. The placenta starts separating. That one can be noticed either by bleeding outside or if it's not outside, the fetal heart rate starts misbehaving.
Right.
So that's abruptio placenta. If they don't intervene, if that woman, for example, the cervix is already fully dilated, that's one I mentioned, that instrumental delivery, if the woman is, and then there's fetal, you can. But if that woman is not fully dilated, you have to quickly find a way to bring out that baby. There is what we call cord prolapse. A woman is in labor, suddenly the membrane rupture, and then the cord, she's not yet fully dilated, the cord is outside.
Okay. So these are the reasons why...
Some of the reasons why... there are still plenty there are so many of them.
Yeah. So now, these reasons, these things that happen, are they by any way or in any way a fault of the woman, or she ate something or she didn't do something right, then now she is
most of the time you can't predict.
It may not be the fault of the woman.
Yes. Other indication for cesarean section include a woman is, one of the complications of pregnancy that we said about when we were discussing maternal mortality is hypertensive disorders of pregnancies. And we mentioned the fact that a woman can have eclampsia. If that woman had eclampsia fits in pregnancy and she's not in labor or in early labor, the only way to save that woman is to quickly deliver that baby. If she's almost delivering, you just have to get that baby out by cesarean section.
Okay.
Even when they have severe preeclampsia, you check the cervix, it's closed, it's not favorable, the blood pressure is 220, 120. Immediately you are trying to control. You must quick, because the eventual treatment is to bring out that baby. So severe preeclampsia with favorable cervix, eclampsia, convulsion during pregnancy, and woman not in labor, in early labor, all of these are indication for cesarean section.
And may not be the fault of the woman.
May not. They are not.
Not the fault of the woman. Okay.
How are you going to be able to predict which placenta will separate? How are you going to be able to? For example, the placenta previa. Who was there when the placenta is?
Yeah.
It's implanted.
She's just doing her. She's just living. She's just living
and everything. And let me say this before we continue. Every couple must get to a level to be ready to accept cesarean section a twinkle of an eye, because 5 minutes may make a world of difference in order to save the baby and sometimes baby and mother. Let me give you an example. A woman is in labor and suddenly had cord prolapse. If action is not taken within a short time, if the contraction continues and there is compression of that cord, that will be the supply of oxygen and nutrient will be hampered, and the baby can die within a short time.
Okay, so this is the point to note now is the couple at any stage should be ready for cesarean section
in order to save the life of the baby and sometimes the life of the baby and the life of the mother.
Okay, we'll go on a quick break. When we return, we'll continue discussion. We'll be right back, viewers.
Now streaming, now analyzing, now assessing, now discussing, now sharing your thoughts on everything and every issue that affects you. ACNN's Now Streaming discusses the issues trending and the matters that matter to us all. Join us every Monday to Friday at 10 a.m. on ACNN as we go in-depth into every issue that impacts our lives, our communities, and our country.
All right, welcome back, viewers. Before we went on the break, we were discussing cesarean section, and my guest is still Dr. Nathaniel Adewole. Thank you very much, sir.
Thank you so much.
So we have been discussing cesarean section. Now I want to look at the types of, cesarean section that you have. All of them are not. I don't think there's any bad one.
No. It's either emergency. Commonest type is, let's say, emergency and elective cesarean section.
Okay.
Elective cesarean section means that we have anticipated that this woman will need operation. With that operation, the outcome may not be good. So that's elective. They are prepared for, they have enough time, they will give you date. They can even give you date from the date you started your antenatal.
So is it a particular condition or somebody can just say...
We are going to call, I'll come to each of them shortly. So I'll give you an example of what can lead to elective. The other one is emergency cesarean section. This one can occur at any time too. In pregnancy, more common during labor.
All right.
So let's start with the emergencies. What are the things? Some of those conditions I've mentioned, they are emergencies. Have to be emergency. They have to be done immediately. There's some emergency. I hope you know there's also a degree of emergency. Some emergency can wait for 2 hours. Some cannot wait for 50 minutes. For example, if you have cord prolapse, it's a case that you want to take within the next 5 minutes, bring out that baby out. And this is one of the, there's nothing we want to get out of here is to plead. We have to get over this mentality of if it's not normal delivery, then it's nothing. Because in some of these cesarean section, time is critical. You don't even have time to waste. Because I've asked situations by somebody, some people will delay and waiting for my husband. The husband will say no. The husband will agree. The wife will not agree. Some will even want to take from that hospital to another hospital. Even something like cord prolapse. Before you get to the gate, that baby will have gone. If it is abruptio placenta, that's another indication for emergency. The woman is in labor or in antenatal, started bleeding, there is placenta separation, it leads to fetal distress. When there is fetal distress, then you have to quickly deliver before they will lose the baby. or before the woman bleeds to death.
You know,
there are so many causes
of saying all these things. I'm beginning to, you know, when we're discussing maternal mortality, I think it's becoming more real why you have more women dying at the point of childbirth. Because if some of those complications come up when you're in your village center, wherever you deliver, there is, if it's 15 minutes, you obviously, you know, die in that process. So it's I think it's just dawning now, you know. And so cesarean section, no midwife, well, not midwife, no village birth center can refer you for a cesarean section, no matter what.
Even if only some of them will be lucky to get there before to salvage the baby.
To salvage the baby.
So these are some of the, but the way our at this we are maybe when we go to policy we address it, but let me put it in. The way a structure is supposed to be structured, there's supposed to be primary health center connected to a comprehensive health center that is not too far
from there.
Yes. And the comprehensive center, health center, they are supposed to be ready for emergency cesarean section at any time.
Okay.
So the only that the implementation of some of these policy
is because that's another one I'm thinking of.
We are going to come there, but let's continue on the types of. Okay. So those are some of the indications for emergency cesarean section. Fetal distress, as I've told you, a woman had eclampsia, a clamtic patient with unfavorable cervix or early in labor. You want to quickly go and deliver to service so that once you deliver the baby, the blood pressure control will be easier. Severe preeclampsia, unfavorable cervix, those are indications for emergency cesarean section. Okay. What are the other indications for elective? Some of the indications for elective cesarean section. A woman has had 2 previous cesarean sections. You don't want that woman to go and try labor. From the day she books for the antenatal, for the next antenatal, you confirm the expected date of delivery with scan. That woman can get a date for a cesarean section. Okay,
so now that's a good one. That's a good one you just mentioned. So if you've had previous cesarean session, two, it's not advisable to attempt vaginal
delivery because it's risky. That woman can rupture. And when there is rupture, we are not talking of only the loss of mortality to the baby, but of the mother. The life of the mother is at risk.
Very interesting.
Great risk. So for elective something like 2 previous cesarean section, a woman that you are monitoring on the antenatal, I discovered that she had placenta previa. Not the very minor degree, but or as at preventable and as even if it's minor, at episode of bleeding. That one should be booked for elective cesarean section. And this is usually done. Elective cesarean section are usually done at term. At term start at 37 weeks plus. Okay. You don't want to wait until they start contracting.
All right. Okay.
Because if you start contracting from home, it will be turned to emergency again.
Okay. Okay.
Because elective cesarean section is still much better than emergency because there is optimal condition.
Okay.
So that's another indication for elective cesarean section, placenta previa. Also, when there is what we call fetal pelvic disproportion or cephalopevic disproportion, whereby, for example, a woman is macro, a baby is big. You had a 4.5 kilogram for a woman that has not delivered before.
Okay. For first delivery.
First delivery. Okay. Or, of course, you have to think of cesarean section, cancel them for cesarean section. That one may not be absolute indication. Okay. You know, even among these elective, there are some that are absolute, there are some that are relative. Okay. I'll come back to that. I think you can remind me. Also, another indication is abnormal presentation and abnormal lie. A woman is at term, 37 weeks, and the baby is still lying across. Transverse.
Okay. Okay. Now that means you can't.
There is no way. There's no way the child. It's like you are lying down, you are lying across to pass through a door.
A door. Yeah.
You have to break that person to pass through that door. So those people, you book them for elective cesarean section.
Okay. Can a woman of her own choice say, I want to deliver. I don't want to, nothing is wrong with her. She's not presenting all these issues. And she says, I just don't want a vagina birth. I want to deliver via CS. If she comes to you, would you oblige her?
Let me say this. Cesarean section also has its own risk.
Okay.
Though nowadays is
minimal.
Minimal in terms of everything. I will cancel her if she insists. Why not? But generally, we prefer a vaginal delivery.
If there's nothing wrong with you.
If there's nothing wrong with you and every access. But if the person insists, there is right to reproduction. You can't force somebody against our will. The person is an adult. After proper counseling, the person insists. It's at the discretion of the obstetrician. Eventually I will section her.
But it doesn't mean that the lady there's any side effect later. She will not be able to take in a second time. I
bet you've seen people that they deliver 4 times and they are still by the cesarean section from beginning and they are still getting pregnant. Cesarean section does not stop.
Yes, most of these things, it's out there. People just believe it. That if they cut you open your first child, I don't know if they don't see other people that have had 3 children. But you see them insisting that because of who knows, you may not have a child.
No, in fact, if you are not careful, if you don't do family planning, in 4 months you carry another baby, which I've seen a lady delivered, though that baby was not alive. In 5 months, she carried twins. 5 months after that one. So even after that does not stop normally. Cesarean section is safe, is straightforward, especially in the experts and quite a lot of people are capable to do it. So that's emergency and elective
method.
Cesarean section. And we must realize that adequate preparation has to be made. But the problem we are having is this issue that is not my portion. Even when it is not important that the woman must have cesarean section. Let me give a scenario. I've seen where a woman that delivered twice through cesarean section. Those one are emergency. I think the first one was because of obstructed labor. The baby was not alive. The second was because of placenta previa. The third one, the baby is alive. The third one, when they told her that she said no. She left the hospital and went. Before she came back, she had ruptured.
What?
This issue of reluctancy, thinking that I must deliver by myself. I don't know where we get that concept. And some of the reason the cultural belief that if you don't deliver by yourself, you are not a woman.
You're not a woman, yeah.
Will it be written on the person's face? Will it be written on the woman's face?
And the reality is that nobody really cares actually that you delivered, whatever method you deliver.
The most important thing is to have a healthy baby to a healthy mother, as we have said earlier.
Yeah.
Some is just out of misconception of faith. I think you mentioned I must deliver like a Hebrew woman.
Hebrew woman, yeah.
Is it not God that gave people wisdom? That when there is a problem, they should be able to deliver that, bring out the babies to save the baby and the mother. And if you say that, no, your mother did not have cesarean section, I used to ask them, okay, your grandparent did not have cesarean section, so you won't have it. Okay, now, don't bother to join vehicle, trek from here to Lokoja.
Because you're trying to, very true.
So you are trying to copy this up and make sure if you are going to London, don't fly by plane.
Go by this or take boats.
Trekking, camel and boat, and see whether your boat can withstand
the pressure
the sea.
Yeah.
So that's a major issue.
The misconception
about cesarean section.
Now, one of the ones, that's the one we cleared, was being pregnant the second when after having cesarean section, you may not be able to have children again, or the doctors might do something in your, sometimes these doctors will go and cut your intestine instead of cutting your, that is the truth out there. But there's also the issue of money, the cost of cesarean section.
Yes, you can't leave that out.
Yes, because it's cheaper to do.
But one thing I want to say is this. Though that is not our major problem, but it's also a major, it's one of the major problems, let me put it that way. The first problem is the misconceptions. The second one is finance. But a lot of government hospitals are actually cheap.
Okay.
A lot of government hospitals are actually cheap.
Yep.
I've seen we have cesarean section, they may not pay up to 10,000. And remember, this people can go and get Hollandians that is up to 20,000-30,000.
That's the thing.
I hope you know that some of these people that even complain, when you see the O1 bear on the 8th day of that delivery, they would have channeled this money to do. And on a very, I don't know, with us, this sense of responsibility. The money to do a cesarean section is not up to the money to bury somebody.
Especially in a government hospital.
Especially in a government hospital.
Okay, we'll go on a break, and when we return, we'll continue this discussion on cesarean section. All right, viewers, we'll be right back.
Crossfire, the program that treats controversial topics on diverse issues surrounding the family, church, and society.
Does it mean if a woman now prays with her hair uncovered, God will not honor the prayer?
Should single ladies ask single guys out on a date?
It's not a sign of desperation. Okay. It's you knowing what you want and going for it.
Okay.
You can't tell me that comedy in the church is wrong. If you go through our Church of Nigeria hymn now, you will see so many hymns written by Nigerians.
You know, a man is seeing something here, he's going for something else. Men are confused.
That's why I said you have to help them out.
We are saying something.
Okay. Sir, can you stop a bird from flying?
Depending. But we are not instituting, we are forgiven.
No, you have forgiven,
yes.
But that forgiveness amounts to a criminal offense.
How?
Hold on. Section 7.
My brother,
anybody can bring
if the foundation be destroyed, what can the righteous do? It matters. So.
No, I'm not saying nobody is destroying any foundation here.
Welcome back, viewers. Before we went on the break, we're discussing cesarean section, and my guest is still Reverend Canon Nathaniel Adewole. Thank you very much, sir.
Thank you.
Thank you for all we've been discussing. We've learned a lot, but I want to tell a quick story. You know, I have one of my mothers, and she wanted to deliver. This was a long time ago, and you know, the doctor had advised that you could only give birth through CS. That's the best way. I think the child was abridged or something like that. And, you know, they were begging her. She said no, she would not do a CS. God forbid that she would go in for CS. And her husband came and pleaded and pleaded. And after the doctor asked, so madam, why don't you want to deliver? She said that her mates will laugh at her that she couldn't deliver
educated woman
herself. And she couldn't deliver herself. And that was the most, you know, one of the most amazing reasons for not delivering, you know, allowing to be delivered by CS, because your mates will laugh at you. I mean, who really cares?
But you know, let me shock you, that as of now, the same thing, people still give the same reason.
Your mates will laugh at you.
Yes, they will say I'm not a woman. You'll be shocked. Wow. Even at this current time, educated, highly educated women, and that's why that's why I didn't, when we were discussing the other time, I did not want to put the money as a major problem. It's not the major problem.
Money is not the major problem.
You know, Nigerians, we have this, Africa in general, we have this, when it comes to issue of childbirth, issue of life, this communal support. The major problem we are experiencing in the hospital is the willingness of the mother, of the woman, or sometimes the husband,
yes,
and sometimes the two of them to accept because of unbelievable reasons.
That's disturbing.
So it's this misconception is what we really need to address.
Yeah, talking about this misconception now, there are people that say, you know, when we're talking, you said after 2 births, a woman might not be allowed to have a vaginal delivery. But what of after 1 birth? Can she still have a vaginal delivery?
Yes, after 1 cesarean section, especially for what we call non-recurrent condition, the woman had up to 70% chance of normal birth.
Okay.
For example, a woman with placenta previa has delivered, the reason was being due to placenta previa. Why would she not deliver normally?
Okay.
Attempt normal delivery for other parameters are okay after, due to abruption, due to cord prolapse. These are non-recurrent conditions. Even sometimes, when the woman had this cephalopegic disproportion, if it's because the baby is macrosomic, that means the previous delivery the baby was big, and the next baby is smaller. Maybe the first baby was 4.3, the next one 3.5 or 3.4. She could still deliver normally. Up to 70% of the women after cesarean section can deliver normally.
But after the 2nd cesarean session,
they advise never to. It's it's very risky. Okay. And let me also correct this misconception. A woman will be canceled for the cesarean section, and then she will go and deliver at home. They say, and doctor said, "Are we?" So the next one they want to try again. It's a dangerous trend. The fact that a doctor says it's advisable you have to cesarean section does not mean that 100% is by you cannot deliver by yourself. For example, if serious effect on the baby or on the mother, you advise them not to go because you don't know which one will be among the 10. And that one person or that be for those 10, that's complete 100% for each of them. So the fact that you have your condition, let me give you an example. A woman came to the hospital, had cesarean section before. The second baby pregnancy, we wanted to try her. And then when we did the weight of the baby, it was around 3.9. We cancelled her that she go for operation. She left our place, the teaching hospital, went to somewhere, she delivered a 4.2 by herself after previous cesarean section.
Which is okay after the first
So she will now be telling people that, oh, the doctor I went and I delivered normally. Funny enough, the 3rd pregnancy, she came and registered in the teaching hospital. We explained to her that, look, if your baby still weighs up to more than 3.5, we'll not allow you to try. She laughed. By the time she was around 36, 37, the baby was around 3.9 again. We canceled her. She did the same thing. They only rushed her one to our labor ward emergency. Ruptured, the baby gone. It took extra hours for us to save the life of the woman. So the fact that the doctor cancel you, you go and deliver, you are taking a great risk. Risk in life is not, if in business there is limit to risk. Why do you want to take risks with a whole life? So this misconception that in doctors had, they will say they said I should have cesarean, I went and deliver normally. What if that person has lost that baby? Some have lost the baby and the mother. Because there are chances that you may not. Yeah, because that's what you call relative. When you see that, it's not that it's a total contract, but you know that if they go through normal delivery for this, the risk is more. The risk is that even if it's just 10%, 10% loss, 10 baby lost out of 100 is calamity. So we must get that. So people coming out saying that the doctor used to say I will deliver normally. I will say that I went and deliver normally. You are lucky to escape. The next time, like that woman, she was able to escape with her life. But unfortunately, she lost that baby and she also lost her womb. Oh dear. So we should get that also clear about cesarean section.
And the fact that also, you know, sometimes people want to use other people as example. The fact that, you know, this person did it and, you know,
she was among the lucky 80 that would not have problem. Affected. But what if you are not among those 10? One person is 100% for that person, for that family. I don't know whether we get
clearly.
it.
Yes, yes.
So even when people give testimony, we should interpret it with care.
Yeah.
Because the person that will die will not come and give testimony.
Of course.
The person that will lose the baby will not come and give testimony. The family that will lose the baby and the brother, they will not come and give testimony.
I think the whole idea is to say it again and again and again. The medical profession is not fighting with God.
No.
They're not fighting with God. Because if there were no medical profession, so many people would be dead.
Yes.
So many people. If not, you can decide, okay, I will never go to the hospital again. Like some people say, I've never taken medicine all my life and I will not take medicine all my life. Good for you. But when you preach to somebody else, you don't know where the person is, where his health.
You don't know the condition of the
health. You don't know the family history of that person. You know, there's so many things people take for granted. And I think it's high time to dispel that. Like the other one of people will laugh at me. Who really cares? If they laugh at you,
on their face,
exactly. Even if they laugh at you, as in, who cares?
If the pain is there, they will even make jest of you.
They will make jest of you that it took longer to deliver. And it's common amongst women who go into the delivery room and in a few minutes they have delivered. So when they see another woman going, they say, I deliver like Hebrew women. I confessed it and I had it. Good for you. But please don't spite somebody else who is trying to get their life. If you give birth through cesarean section, it's not that you are a weakling.
No.
Or God does not love you. In fact, God loves you. That is why
that's why I didn't want you
was available.
Yes. That's why I gave the intellect for you.
The intellect for you to, because I know before the process was more.
And it's easy now.
It's easier now. It's very small. It's
very small. This is not big. Nobody will see it. It's usually at the panty lining. One, you will not sleep. You'll be discussing. You'll be the one to kiss your baby while in that operation while they are still. You'll be discussing with the doctor and the nurses. You will kiss your baby yourself. You will tell the sex of the baby. As you are getting to the bed, they will put the baby to your breast.
Yeah.
In 12 hours, you start taking.
Beautiful. She just talks about breast because there's another one that when you give through CS, you were not able to breastfeed.
That's not true.
Okay. Please
That's not true. Immediately, right? Immediately the baby is delivered. While they are still preparing, you kiss the baby right there on the operating table. As you move the operation is within 25 to 35 minutes in most cases. You are taken to the bed. You'll be able to support your baby with the help of the midwife to breastfeed that baby immediately. We are even interested in the colostrum that will come for that baby. And you'll be in 12 hours to 24 hours, you start.
Yeah.
You start taking sip and oral. Catheter will be removed. You can move around.
Now, one thing again is, that breastfeeding part, because I remember when I was in the university when we've been taught a bit about this, that it's actually the lip of the baby that stimulates the production of the milk. So sometimes they say drink this, it will make. I don't know how it works, but
you need fluid.
You need fluid, okay.
But what that makes you are very correct. Milk ejection reflex. When the baby suck, it sends the hormones to the brain to produce more hormone to produce the breast milk.
Okay.
To stimulate the breast tissue to produce more milk. So that's what milk ejection reflex. So that's why usually even after the operation, immediately they will start putting that baby to breast as frequently as possible to stimulate more. And they are not. You eat. You can eat up even if it's going to be taken in the morning. You can eat up to 10. Sometimes they just say, okay, be on light, be on fast for about 4 hours if it's done in the day and it's elective. It's emergency. Even if you have just eaten now, they will take you.
Okay.
So it's not that they are dehydrated again like before. It's not like before they will say, wait for 40 days. In 12 hours, you'll be able to sip something, start moving around, 12 to 24 hours.
And I've seen that.
By 2 to 3 days, you are home.
The hospital.
So easy, stressless.
Okay.
It becomes more complicated when before the operation, for example, prolonged obstructed labor. It's already complicated. There are issues that may sometimes stay long.
Yeah. Okay. So let's look at complications. In as much as it's a positive, we've talked about the positive side and the importance of it, but there are also complications.
Yes, there is nothing.
Yeah, of course. Even the vaginal birth, there are complications that come from it. Yes.
Even drinking water too much. One is most of the commonest problem we used to have is anesthetic complications. But with the advent of the spinal regional anesthesia, spinal epidural, that has been minimized to the barest minimum. And with the expertise, is not anesthetic complication is not common again. Unlike before, when they will let the woman sleep, the aqueous situation, all those ones are off. Then the other thing is hemorrhage, bleeding. But remember, it will also occur
even a normal
delivery. But steps are already there to be taken. Oxytocin will be given. If it's necessary, ergometry will be given. Misoprostol can be administered to take care of that. Infection is minimal now with good antibiotics. The only thing I still want to plead is the issue in our country of fake and substandard antibiotics. Fake and substandard antibiotics. Please, want to appeal the conscience of us Nigerians. Any of this, even if you say that I will not be affected, you don't know where your cousins are. We should stop importing or accepting fake and regulatory bodies should also live up to the expectation in order to combat this issue. If not, the infection should be very, very rare.
Antibiotics, fake one is more dangerous. It is so dangerous.
So that's one area I want to appeal to the public concerning this issue. Then most of the other things are just normal things, nothing to. Then the only that after this is on a lighter note, the spinal anesthesia that we use that I brought make it so safe, so easy, so convenient. Occasionally to have headache. What we call post-dural headache, but most of the time, after a few days, it will go. Even with that, the only that if it occurs, they should lie down on their back. You know, it's postural. It's when they stand up mainly.
That the thing happens.
Yes. And then we normally also tell them to reduce that in the theater. Avoid raising your head, and also for the first 4 hours when you get to your bed, avoid unnecessary raising your head.
So what to expect after CS?
What to expect is, well, just like you said, there's nothing right from theater. You will kiss your baby, you'll be gisting with others. Once you get, you'll be able to touch your baby, you'll be able to breastfeed your baby. The drip will be on, of course, antibiotics in 12 to 24 hours. You will start your taking orally, small, graded oral fluid, not immediately you start eating akpu or amala. But within 48 hours, you'll have taken, you will be free to take pepper soup and all these other things. Then all the catheter will have been removed within 12 to 24 hours for you to go and urinate by yourself. In 48 to 72 hours, you are home in most cases.
Before we go, I always like that last question, that ending question that is always, somebody might be watching. Our mothers have all this soup and food and things that they tell you to drink that is supposed to flush the remainings of
the bad blood,
the bad things, and as you're drinking it, the hot. There's so many things that have come out these days.
Like what?
There's this pepper soup that's very hot and peppery. They tell you to drink that to help you flush. There's also the leaf now. It's from a particular part of the country that they cook for you to drink to flatten your stomach and make your stomach come back flat and wash out anything that's
things are fallacies. Those things are what? Fallacy. Old man's fable. The truth of the matter is that it can even be more dangerous. They are ghosts and other things. Eat normally. Eat what?
Normally.
I've seen women that after 4 kids, for operation, the stomach is very flat. Have you not seen people that have not delivered and the stomach is big, especially as they approach middle age?
Yes.
So this craze about I must have flat tummy. It's good, but those things does not work. And it's most of the time it's not even because of the cesarean section. Because after a few days or weeks, you can go back to your schedule and other things.
Even normal vaginal birth, they will tell you drink all these things.
If it's pepper soup, you can remember I mentioned I don't have anything against pepper soup.
But it's not that it is flushing anything.
No, it's not to flush anything out. Whatever enters the stomach we go out
through
the
anus.
So it has nothing to do with that
part of the, I think there's a conception that the womb is here, so everything that you enter just drops here.
No. That's a fallacy. One of the things as we are concluding is that I want to encourage our women, our men, to come to reality that the cesarean section is to save the life of the mother and the baby. There is no difference between whether you deliver by yourself or by cesarean section. It's never written in anybody's one. The most important thing, the goal of pregnancy is a healthy baby to a healthy mother. One trauma, either of the baby or the mother, is 100%. And it cannot be reversed. There are risks that are not worth taking. If you die, if a doctor cancel you, especially when you have time, if it's elective, if you doubt the integrity, instead of going home that I will not go to hospital, why don't go to another expert and seek a second opinion?
And also, you know, people listen to stories. Oh, I went to this hospital, and when I go to this hospital,
I want to ask them a question. If their mechanic tell them that this engine, the ring is weak, would they go home and put the car and say that the car will work by mechanical? Would they not go to another mechanic? So if we can, we treat our machines better than ourselves. That's the reality.
So cesarean section is not a bad thing. It's for the life.
It's a life-saving.
So that's about what we're taking over. Yes. But just finally said, what's the maximum number of children you can have with CS? At what point do you tell, okay, madam, is okay? You have cut you open 3 times, 4 times. You can't have again.
There's no particular number, but usually I advise maximum of 4.
Maximum of 4.
But it's not that there is a law that say you can't have more than 4.
Yeah. Okay. So maximum of 4, advisably.
Advisably.
And what do you want to do more than 4 children in 2021?
No, but it's not that we do know you can't have anything more. No, but of course, after one, why do you want to risk your life?
Yeah.
Why do you want to? 4.
Does not enjoy yourself and live well. Well, thank you very much, sir.
It's always a privilege.
So much. I've dragged so much from you.
No, it's always a privilege.
I've dragged so much. I've not stopped calling
you. It's our responsibility.
Yeah. To
always educate until we're able to get, knowledge is power. If people are aware, we'll be able to save the life of our women.
Yeah.
Our young ones.
Yes.
It's critical, and it's something we must do regularly. We want to appreciate you for your efforts too,
in
order to improve the health, not only of the general population, especially of the women.
Of the women, exactly. I'm excited that we've spoken a lot about women, and I'm excited about the one of drinking all those things to flush
No, please, they should stop
the womb. So if you're among those drinking and trying to flush the womb, it's all fallacy.
And everything. No, it's not. It does not help in this situation.
Thank you very much, Reverend Canon, for coming on the program. Thank you. I've had you for a while. You're passionate about women, and really appreciate you for that.
Thank you so much.
Thank you. Thank you so much, viewers, for watching with us and sitting with us and listening to us. We're so happy that you have learned so much today. And I hope that the few things we've been able to communicate today, you will take it, think about it, and let's do a lot to stop losing our women. It's not worth it. And this is not just for women, for men, and for everybody who loves women. God bless you. I am Angela Mweze. Goodbye.